my two best cases. In my 30 years of career, I have prescribed thousands and thousands of times in different cases, in acute as well as in chronic heavy pathology. In India and in different parts of the world, my main consulting room at present in the UK, in London, and amongst all these, I still believe these are my two best cases. My first case is a case of cystic hygroma. And you know, cystic hygroma is quite an interesting pathology. This is a story of a young boy who came to me with a massive swelling diagnosed as cystic hygroma. You see the swelling over here, and that's quite like almost the size of a grapefruit. And this is before homeopathic treatment. Here you could see, as it is cystic, the fluidous aspect of the case at the commencement of the homeopathic treatment. And this is very interesting. He first went to the pediatric surgeon who said even after surgery it might come back. So they decided not to go for the surgery. This is at the commencement of the treatment. The young boy lost his hope, his life that he was not enjoying. The swelling is, from the lateral side. And then 2 months after the treatment, the swelling has reduced to a certain extent and there are glandular aspects there. You see, it started coming down. The glandular aspects are still prominent. 3 months after the homeopathic treatment. This is 3 months after the homeopathic treatment. Swelling more visible in the posterior part, but from the anterior part it has gone. Decreased swelling. Swelling gradually diminishing. Have a look at this. Some of the glandular aspects you could see here. It's going down. Much better 8 months after treatment. 75% decreased. Almost you could see the flap of the skin 1 year after the homeopathic treatment. Much better. Getting down. We are getting there. 12 months after the treatment. Completely better. I will show you from the side also. It's almost gone. This is 22 months after the treatment. And this is the final picture I have, which is, once again I diagnosed the case miasmatically. There was quite a bit of psychotic aspect because the lump is soft. There was profuse sweat on the head, and I prescribed calcarea iod to this case. But as I said, the emphasis on the medicine is not very important. I prescribed calcarea iod because of the iodum glandular aspect in a calcarea constitution, hot patient. And a swelling like this, I will just quickly go back to share with you what it was right in the beginning. This was the first picture. You have seen this before. If you focus here, you could see the huge aspect, and that was the case. And from there, we have this young boy here. You could see that the swelling has completely gone and never came back. And once again, that's the beauty of classical homeopathy. And followed the permanent recovery axiom of Hahnemann as well. And thank you very much for coming today to share the case with us. Thank you. This is an interesting case of brain tumor. When the patient first came to me, she was 23 years old, and this is a prescription chart of a consultant neurologist who is diagnosing this as an intracranial SOL. SOL stands for space occupying lesion with low reflexes, and general condition was very, very poor. So this is the diagnosis by a neurologist, a consultant. This is the first picture, 23 years old, diagnosed as brain tumor, brought in a stretcher, seen here at the start of the homeopathic treatment. She has lost all hopes. Constant, extensive dull headache. That's the reason she is holding the forehead in a case of brain tumor. All hopes are lost. There's a clear reflection of apathy in the face. And this is the report of the CT scan, plain and IV contrast enhancement scan. It clearly says confirmed case of space occupying lesion in the brain. It could be hemangioblastoma or cystic astrocytoma. You know, astrocytoma is malignant, and considering the patient's general health was so poor, within 3 months she was in the stretcher, Her general condition was extremely poor. So, most probably, this is a case of malignancy. This is an electroencephalography report, and here also it says that the EEG report indicating of interseizure pattern. So, there was abnormality in the EEG report as well. When she was taken to the neurosurgeon, she said the tumor is located in such an area and expansive in nature, and as her general condition was so poor, she might die on the table, or even after the removal of the tumor. As she is already bedridden, her reflexes are so poor, she might end up with quadriplegia, which is paralysis of all extremities. So considering that, they decided not to do the surgery. And the first thing happened after giving the homeopathic medicine. Remarkable improvement with homeopathy in 3 months of treatment, celebrated the improvement by being pregnant. She got pregnant in 3 months. She was on her legs, and you could see that there was a pregnancy there, absolutely no problem after the homeopathic treatment. Details written and signed by the patient and her husband that how they refused to go for surgery, and dramatic improvement by homeopathy. And this is the follow-up CT scan of the brain. Now everything became normal in shape, size and position with the septum in the midline. If you look in the previous CT scan, the septum was pushed to one side because of the tumor, and now it came back to the normal after 15 months of the treatment. And now the mother and the child both are happy, smile back in the patient. Homeopathy, the rational art of healing gifted by gracious God to the suffering humanity, and look at the smile. With the family, normal strength and vigor is back. I think that's the last slide with her happy family. She is absolutely normal. The miasmatic analysis, I have mentioned that in my book. There are soric aspect, there was psychotic aspect. It's a mixed miasmatic case, but there was psychotic preponderance, and I prescribed gelsemium to the case. There were a lot of gelsemium symptoms which I'm not going to discuss in the short video, but what I have tried to share with you, homeopathy can do it. So once again, going back to the case where it was a case of brain tumor, where all the hopes were lost, there was a clear apathy in the face, and if you look in this, neurosurgeon didn't give any hope, and that lady is here with us today after 22 years. This is our Pushpo Rani Jana. After all that time, she is here, and this is another wonderful, wonderful case in homeopathy. That case where she was brought in a stretcher, and now she is doing all her normal duties, and the glory goes to gelsemium, Hahnemann, and his beautiful homeopathy. You are all right? Apni bhalo achen? She is absolutely fine, and that's the beauty of homeopathy. Thank you very much. Thank you.